Okay, let's move to one of the most challenging manifestations, which is the PPH. Though it's one of the easiest and one of the most direct stations, but still it's challenging because it has some sort of definitive management right now. Okay, so let's start the station. The station says that the patient has just come out of the fifth delivery and she's feeling unwell right now. Your nurse colleague is waiting for you inside the cubicle. So the moment you'll enter the cubicle, you'll find your nurse colleague jumping into you. Doctor, help me please. Mrs. XYZ, she has been deteriorating after her fifth delivery, doctor, and she's feeling unwell. Introduce yourself and reassure the nurse and say, I'm here to help you. We'll sort it out for the patient in a while. Do you know what happened to the patient? She will tell you, yes, doctor, she has come out of her fifth delivery and you see her vitals. There could be a monitor inside the cubicle or there could be a news chart, but mostly there is a monitor, and you will find that the blood pressure is low and sometimes the oxygen is low as well. You can verbalize that the blood pressure of my patient is low and the oxygen is low. Can you tell me more about what happened, please? Yes, doctor, she has come out of the fifth delivery and she has been bleeding. Ask the nurse right now how much she has bleed. She will show you a bucket full of blood. Now the cause of bleeding after the delivery is probably postpartum hemorrhage. So now there are four causes. Number one, retained placenta. Number two, trauma. Number three, bleeding disorder. Number four, uterine atony. And since she has come out of the fifth delivery, most common cause is uterine atony. So simply ask the nurse, have you seen the placenta? She will tell you, yes, doctor, or she will tell you no. Okay, ask her about, is the placenta completely expelled? She will tell you, yes, doctor, or I don't know. Okay, this is number one. Number two, are you aware about any bleeding disorder our patient is having? She will tell you yes or no. Do you have any idea if our patient had any trauma during the delivery or not? She will tell you yes or no. But probably you know that since the fifth delivery, so uterine atony is the most probable cause. So tell the nurse right now that my patient or our patient is definitely having right now a hypovolemic shock due to postpartum hemorrhage. Excuse yourself from the nurse, move to the patient. Hello, I'm Dr. X, one of the junior doctors here. Can I confirm your name, please? Sometimes the patient will respond and sometimes he will not reply because the patient is confused. So you will tell the nurse, okay, can you help me please? I need to first of all ask the nurse if the patient is having any smoker cough. She will tell you no, doctor. Then place oxygen over the face of the patient. But before that, I need to have a look at the airway of the patient quickly. Okay, so have a look at the airway of the patient. Open the mouth, you will see nothing. This means that there is no obstruction in the airway. Okay, ask the nurse to place the big mask of oxygen, another breathing mask, 100% oxygen. She will tell you, okay, doctor, assume the oxygen is improving right now. Move to the B, which is the breathing. Listen to the chest in 10 seconds. You will find the chest is clear and free. So the breathing portion is normal and the oxygen saturation matches this and the respiratory rate is fine. Okay. Number three is the C, which is the core here. The core, you will tell that the blood pressure of the patient is low. This means that we need to attach two wide bore cannulas. She will ask you which cannula, doctor. Say orange cannula. Doctor, we don't have orange. Okay, attach the gray. So number one, orange. Number two, alternative is gray. Okay, where shall I place them, doctor? Place them in the arm or in the hand. Okay, doctor. What should I do right now? Okay, can you take some samples from one cannula and inject oxytocin on the other side? Which sample? The samples are full blood count, okay, LFTs and KFTs, and ABG. Also, don't forget clotting screen, and more importantly, cross-match and blood group for units of blood. And on the other side, I will inject 10 units of oxytocin bolus. 10 units oxytocin bolus. Okay, so now I give oxytocin and from the other side I took sample. Okay, so now you can attach one bag of pre-warmed Hartmann solution. Most probably the bag will be 1 liter. So you will ask the nurse to attach this bag Meanwhile, you will start doing the uterine massage. To do the uterine massage, you have to place your hand just below the umbilicus, your non-dominant hand below the umbilicus, okay, to squeeze or to roll over the fundus of the uterus and support the lower part or the pelvic part of the uterus by your dominant hand, which is the right hand. Okay, so the nurse did the fluids and you are doing uterine massage meanwhile. So basically this is like, how can I say, this is a multitask station in which you have to do something and the nurse do other things. So then after giving the fluid, she will ask you, doctor, over how long? You will say over 15 minutes. In any hypo, either hypoglycemia, hypovolemia, or whatever, you will give over 15 minutes. Okay, so look at the patient monitor right now. You'll find the blood pressure is still improving. It's now 95/65, which is improving slightly, but still it's not normal. So I ask the nurse to attach one more bag of pre-warmed Hartmann solution to the other side. Okay, this is 2 liters so far, over 15 minutes again. And after that, ask the nurse to attach urine catheter to empty the bladder and to monitor the urine output of the patient. This is very important in any hypovolemic shock and especially in the postpartum hemorrhage. I have to empty the bladder to avoid any further compression on the uterus and also like facilitate the uterus to expand or to contract or whatever. Okay, so after that, actually what I will do right now, the blood pressure is still not improving so much. So what will we do right now? We will need to inform our senior, thank the nurse, and we need to inform our senior right now. At this moment, actually, the examiner will take over and she will tell you, doctor, I'm your senior consultant from this department and I need to know what's wrong. You will tell the examiner that my patient is having hypovolemic shock due to postpartum hemorrhage. Why, doctor, you think so? Because my patient vitals show, and you will say the vitals from the beginning. I mean, the oxygen was low, the blood pressure was low, and the pulse rate was high, and the breathing rate was high, temperature was normal. Okay, and since the patient has come out of the 5th delivery, this means that it's probably postpartum hemorrhage. What could be the causes, doctor? The causes could be either bleeding disorder, or trauma, or retained placenta. But since my patient has come out of the 5th delivery, I suspect uterine atony to be the most probable cause here. What have you done, doctor? I have given. You will say what you have given. Beside that, I have attempted uterine massage till my senior takes over. Okay, what's your next step, doctor? You will tell the examiner that first of all, I need to give my patient further uterotonic drug, either carboprost 0.25 milligram IM or misoprostol 1000 microgram per rectal. This is to stimulate the uterine contraction. And if the bleeding continue, I will give the patient tranexamic acid 1 gram IV. Okay, and for any hypovolemic shock, they're always associated coagulopathy. So I need to correct the coagulopathy by giving fresh frozen plasma. And if possible, I may consider blood transfusion to my patient. Okay, what is the further plan of management, doctor? I will now, if the bleeding continue, I will need to me and my senior will examine the uterus under anesthesia for any perforation or retained placenta. And if any trauma or perforation is found, it will be sutured under anesthesia. Otherwise, we will consider doing uterine packing or balloon tamponade to stop the bleeding before any procedure. Okay, what's next, doctor? If those methods or these measures didn't help, we might consider moving the patient to the theater to do uterine artery ligation or internal iliac artery ligation or ultimately hysterectomy to spare the patient life. So simply, this station is hypovolemic shock, but the only extra things are the oxytocin and the C portion, which is very important because it's definitive here, and preferably you give the oxytocin as bolus before giving the fluid because you already knew that most probably it is uterine atony. Otherwise, you will give the oxytocin as drip or infusion, And when you give it as infusion, the nurse might ask you about the rate of infusion, and you will be in dilemma. So better give it as bolus, and it will not harm the patient at anything, and actually it's useful because it acts instantly, and it's recommended to be the first line treatment in the primary postpartum hemorrhage due to uterine atony. Okay, this is the station.